Today we're really excited to announce a new step that the Seattle Fire Department is taking for a healthier downtown Seattle with the creation of a new pilot program that for right now we're calling Health One. I have to say that we will have a team of specially trained Seattle Fire Department firefighters and civilian specialists. We'll help people downtown with non-emergency 911 calls for issues like substance abuse, non-emergency medical issues, and need to access services including people experiencing homelessness. This new pilot program will appropriately address and meet the needs of individuals with non-emergency 911 requests in and around downtown Seattle. As our city grows, we know that our ability to deliver non-emergency responses has to grow with that city. And I know all of you think that I believe everything good was invented in Seattle, but we were the city that pioneered Medic One, which became the gold standard in emergency care in cities throughout the country. We know that non-emergency needs a similar level of response in our growing urban environment. And we are trying this pilot to see if perhaps that might be the next step in urban response. It really allows us the ability to respond to our most vulnerable residents while also making sure that our taxpayer dollars are being spent efficiently and that we're reserving our emergency responses for true emergencies. We want our fire engines and our medics to show up at those life-saving critical incidents. This will give us the ability to make sure that we have a good response for those non-emergency responses, to be able to connect people, sometimes with health care, sometimes with their case manager, sometimes with an emergency response if it's deemed that way. I can't say enough about the Seattle Fire Department and the way it has responded in the last years as we have grown as a city. We have seen our city grow by over 100,000 people. And yet our fire department is almost as lean as it was when that growth started. They are working every day to keep our city safe, to respond to emergencies, everything from fires to heart attacks to what happens day to day throughout the city. We're seeing those emergency responses many times don't need an emergency response, and that if we can have a way to deal with the low acuity calls that we're getting in a humane way to connect people to services, to get them the services they need, we will serve them better and we will free up those resources of our fire department for what they need it.